Welcome back. Today I want to talk to you about what is your hygienist really doing and are they doing a good job? Very excited to be back. Thank you for being so patient. The YouTube channel has grown tremendously since we last got on here. So thank you for all the subscribes and likes and comments on the YouTube channel, because that is just going to be so helpful for us to share this with other people. We're going to be giving you regular content, and that we're going to start today, we thought, with something that really sort of spurred our, concept of maybe people don't really understand what hygienists are really doing, and they don't know whether or not a hygienist is doing a good job. So that is going to be the topic for today's episode, is how do you know your hygienist is really doing a good job? First of all, your hygienist is seriously like an angel for the most part. I mean, if you have a hygienist who causes you pain and makes you feel bad, it might be time to get a new hygienist. However, most hygienists are not like that. They're very excited for you, they want to see you do well, and they're very good at their job. What people don't understand is that they are actually their own kind of therapist. In fact, in some places, you'll find hygienists actually work independently. We have in this country alone many hygienists who can work independently. You just have to have a checkup with your dentist. Usually I think it's around once a year. But most times you'll see the dentist and the hygienist working as a team, and the whole team working as a team, of course. But the hygienist really is sort of their, is a therapist for your mouth. They're really looking for things like the dentist would, and oftentimes I don't think we give them enough credit. What tends to happen is that they're thought of as just cleaners of the mouth, right? And this is not at all what they're looking for, what they're doing in your mouth. So today I wanted to clear up a little bit of the misconception about that, particularly because we had a patient that came in about a week or so ago, and we kind of went above and beyond, and yet there wasn't a lot of understanding or appreciation for what the hygienist did in that time in order to make that happen for the patient. And so it just kind of made us realize that probably in a lot of times the patients, or sometimes some people, don't realize what the hygienist is really doing for you, what they're looking for, and how important they are as a therapist in the role of, total care for your oral health. So without getting into, all the details of the story, the gist of what happened was the patient was booked for a certain amount of time and expected to be, treated in that time. And they were from a ways away. We have a lot of patients that come from all over the province and outside the province. And so when they come in, we do want them to receive as much care in the time that they've invested with us. So there was an extra effort made to, although once evaluated the patient's mouth, it looked like it was going to take a lot more time than the patient was actually booked for, we did go above and beyond to try to move things around so that we could complete the care so the patient wouldn't have to come back. Can't always do that, but in this case, we felt, let's really try. So that was what was done, and yet at the end of the appointment, there was still this misunderstanding, I think, about the value of that. And so what I wanted to say, I guess, is that the hygienist is really, like I said, more of a therapist. And as any therapist would, or even like a doctor or a dentist would look at you, we can't just do the work. We have to take into consideration all the things that are important in order to come up with for a diagnosis. And hygienists need to diagnose in their own way. They need to come up with a sort of a targeted understanding of what they actually need to do in order to perform it, and then track your healing or your progress based on that. So there had to be, in this case, some x-rays that had to be taken. There were some photographs and things like that, because we want to document where you are in order to see your progress as well. But there also had to be an evaluation of what was below the gums that we couldn't see. Now, in this particular case, again, this patient needed a lot more hygiene therapy that day, there was a lot more tartar and things like that built up on the teeth. And so in their mind, they were just coming in for a teeth cleaning, but they really needed to have these radiographs done, and they need to have a little more education. And there was a lot more buildup. And so gets me into my next point, which is your appointment time when you're with the hygienist can really vary. It can be different depending on how well or what kind of situation or how long it's been since you saw them last. So if you regularly see the hygienist every 6 months and you're exactly the same with your oral hygiene, then perhaps you're going to get the same length of appointment the next time you come back. However, if you are overdue, what we call, where you have to change your appointment and you don't get in until a few months later, or maybe it's almost a year, and with the case of COVID, we had many patients, it had been a very long time, then there's a lot of catch up to do. And so there's a little bit more evaluation that has to go into that appointment, and there also has to be more time to carefully remove the tartar in a way that doesn't cause you discomfort. Of course, they can just go in and, clean very aggressively, but we want to make it so it's comfortable for you. So it has to be done in such a way that we take our time, we evaluate as we go, and then we also need more time. And in some cases, it means that you may have to come back for that another appointment in order to complete the total care. Now, this is not what we want. Of course, we want to make it convenient for you. However, we also care about, this is your health, right? So sometimes we all want that quick fix. We want that pill. We want that one-time, massage that's going to make us better. But as you all know, if you've ever injured muscles or you've ever caused any sort of other problems with your body, our body takes a little while to recover. And so it can take long for the treatment to occur, but it can also take long for the healing to occur. So it may mean you even have to come back for a follow-up to evaluate the success or the response of your tissues to the therapy that the hygienist did. And when I say therapy, I really mean it. When we're removing large amounts of bacteria and buildup around the teeth, it's not a cleaning. We don't clean your teeth like you clean your car, right? Take out the trash, buff it, rinse it, done. No, we're actually doing something very therapeutic, and it means careful consideration for the tissues around. If you have crowded teeth, there's going to be a little bit more challenge with that. That's why straight teeth age better, and cleanings are usually easier in someone who has straight teeth than someone who has very crowded teeth. So when we take all that into consideration, I guess my point is that I just wanted to make sure people realize that there is a lot that goes into the hygienist's therapy, and they are in their own way providing you, medical care of your mouth and your oral condition. And can't always happen in one appointment. And sometimes, depending on the interval and crowding and other factors, let's say you're a smoker even, it can really impact how many times you have to come back. So how do you know whether or not your hygienist is doing a good job? Well, I'm going to give you a little checklist that you can go through to see if you are getting that kind of care, and what you can then kind of be more knowledgeable about whether or not you are getting good care. The first is a hygienist taking a look around your mouth before they begin? Are they just sort of diving in and scaling or cleaning your teeth? Secondly, if you're due for radiographs or things like that, are those being done at regular intervals that are customized to your needs? If you have a very low cavity rate and low gum disease issue, then maybe that interval could be as far apart as every 2 years. But if you have a lot of disease and a lot of problems, you should be getting those x-rays anywhere from 6 months to a year. Secondly, are they giving you customized instructions based on the type of tartar and the where and places they find tartar in your mouth? And are they asking you good questions that help you grow and improve as a patient and have less problems in the future? Next one would be probably, are you comfortable during the appointment? Are they responding? Yes, of course, you can have a sensitive tooth, you can have a little discomfort here or there, but are they stopping and being respectful and checking in with you to make sure you're comfortable all the way along, so that you don't leave the appointment feeling like you were traumatized in some way? And lastly, I think setting up and educating you on why you should come back at a certain interval. Again, we believe it's in customized care. And so if you're really good, you floss well, you have straight teeth, you hardly have any tartar, you can probably go a longer interval between cleanings or hygiene therapy than somebody who has a lot of crowding, who may be a smoker, who has a lot of buildup, doesn't floss. So we should be educating you on why that interval is so, and then setting you up for the next appointment and making sure that we kind of follow up with you, so that, because everybody gets busy and we do forget. So these are the things who help you decide or know whether or not your hygienist is doing a good job. I hope this was helpful. Please subscribe to our channel. It helps us help more people like yourself, and we will see you next time.